All right. Assalamu alaikum to everyone who have joined us. I am Hasnan bin Tahir, the head of academic for Awanzoa, and I would like to thank everyone for spending your time in listening to our session. So, what is our session about? So, as you guys have seen, that Samba, is the recording started? All right. Okay. Thank you very much. So, as you guys have seen, we are having some troubles, in Malaysia with the overflow of doctors. So, we are going to introduce you to our expert who has been working in UK for a year now, who is Dr. Musaab Nasruddin Ahmed, who is a junior clinical fellow in acute medicine department, which the Malaysians are not aware about, at Queen's Hospital Burton in UK. So he's also our super senior from Kaizen, batch 17. And when I was in my first year, he was in fifth year. But the thing is, we are also having people from Invictus and Razors who will know him better. So if you guys have any questions, you guys can write it in the chat box, or you guys can always open up your mic to ask any questions. This is more of an informal session. And without further ado, I would like to call upon Dr. Musab to continue with the session. Tafadhal. Bro, you are muted.
Now, okay. Assalamu alaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Okay, so thank you everybody for attending the session today. And thank you Hasnain for that wonderful introduction. I'm not sure about super senior, I just a normal senior. But I will try my best to give you a super presentation today. Okay, so as Hasnain has mentioned, the today's session is called From the UK with Love. So it's like a very informal session. It's just it's mixing between me sharing my personal experience and also with some information, like practical information about what you need to do if you want to move to the UK and so on. What else? So yeah, you can have the opportunity to ask questions at any time. I will try to give a few slots in the middle of my presentation for you to ask questions. Hopefully, I mean, I know we are international university, so I will be speaking mostly in English, but I may also flip to Malay because I miss speaking Malay, and this is my one of my chance. So hope you can bear with me. But I won't say anything important, or I will make sure I translate. Okay, so the presentation today, I will be lots of pictures, a lot of things you can find from Google. And to be honest, I think maybe majority of you probably may not find this useful, or you may not actually end up going to UK or anywhere else. But the reason why I did this presentation today is because when I was a student, international student, of course, uh, I didn't have any support. I didn't know anything about what's going to happen to me after I graduate and so on. So the first reason I did this is to help the other international students. And the second thing, I always believe that even if you are not going to do something, at least you have the opportunity to expand your horizons. So even for our local students, I think even if you can, like, if you dapat tahu like what other people go through, or like what are the other options, then maybe whatever looks like situation in Malaysia is, it doesn't look so bad. Or what I hope it will actually do to you is, I hope you will appreciate what you have and you will fight harder for it. So I know we have recently seen some of our medical doctors, they are doing, like hartal and so on. And I really salute the effort. So I hope that when you see what I'm going to present and what people have to go through, you will fight harder to preserve KKM and to preserve Malaysia. Okay, what else? So hopefully by the end of the session, like I said, I will share what I have gone through. I'll give you a more or less like a brief journey of what I have gone through, and hopefully you will get some insight into what is needed to move to UK. Or I will also mention a few other countries like US and so on, and I will give more or less a brief guide, but a lot of things you can find in Google. Okay, before I go any further, I just want to ask, first of all, and you can just share this in the chat box. You don't all need to shout this out. Who has read up about this before? Who has any plans, like serious plan, not serious plan, but who has just thought about this, that they want to leave Malaysia after graduation? If anybody has, just put in the chat box. I will have a look. I just want to see.
I don't know. Me too.
Yeah, go ahead. Sorry. Yeah, okay, quite a few people. Hadri and Amon. Okay. All right. Okay, quite a few people. All right. I mean, okay, that's interesting to know. And I hope to support you throughout your journey. Like I said, when I was doing this, I didn't have any support, so I hope I will be able to support you. And let's see what the journey is like. So to introduce myself again, that's me on the far left. I'm sure you recognize this place. This is in front of the auditorium. So hopefully you guys yang Avenzoa, you will be here soon for your oath taking ceremony, inshallah. Okay, so these people are my study group. And I said earlier to Hasnain, I will talk a bit about pro exam. So if it's not too late, I personally, I always advocate for study group. One of my biggest regret, we always say this, all five of us in this picture, we always say that one of the biggest regret is that we didn't start the study group earlier. So we actually met at the beginning of, bukan met, but we formed the study group at the beginning of year 5. And honestly, I don't think I would have done as I did without all of them. It's a very good support system. Again, I think Alhamdulillah, we were lucky that we all gelled together very well, and it was like one of the highlights lah, I think, for the final year of medical school. So again, I know ACAT always tell you this because I was ACAT previously, and I always try to tell people, please join study group. Again, I know it's not for everybody, but try to explore it first, and hopefully it will help you in your studies. We even made the joke at the end of the 1 year when we were after we passed the pro exam that if we had started study group earlier, I think we could have passed any master exam, any MRCP, we could have passed it together. And I don't think we were kidding. We were really serious about that. So yeah, I was 17th batch Kaizen. So graduated in 2018. Alhamdulillah. And what else is there to say about me? Oh yeah, so I'm originally from Sudan. I think most of you know that, but I was born and raised in Malaysia. So until I had to leave medical school, I was living in Malaysia for my whole life. So it was quite a big event for me lah. But we'll get more into that later. Anything else I need to say? No, that's it. So this will be the outline of my presentation today. So like I said, I will talk about my journey after UIAM. And the way I will talk about this is I will go through a few parts of my journey throughout my presentation. So I will intersperse that with in between the rest of the presentation. The rest of the presentation will be, first of all, the main point you're all here for today is the pathway to UK. And I'll mention briefly about some other countries, US, Australia, Canada. And we will talk about this in terms of academic requirements, which means exams, registration, and so on. Financial requirements, which I think is probably the most important thing to look at, to be honest. And timing, which is also very, very important, honestly. I will also mention briefly what international medical students can expect after UIAM. So how to prepare yourself, especially for international students. It's a bit different for local students, I think, but this is a bit more for international students, but it can apply to everybody. I will also share my NHS experience. So NHS is the National Healthcare Service. That's the KKM of UK. I will share what it's like working in NHS, and we'll get briefly into the specialty training, how to enter specialty training in UK, and a bit in the US as well. And lastly, I will share some references for where you can find more information, which are very helpful and which I use here today as well. Okay, without further ado. So part 1. So like I said, we will go through a few parts. So I hope you're all familiar with this Kubler-Ross grief cycle. If not, I will tell Dr. Nizam that you are all not attending your psychiatry lectures. So for me, after UIM, not even after. So this all started for me around end of year 3, beginning of year 4. So time to like you when we go into hospital, we see the houseman, and at that time I start to know, later what's going to happen to me after I graduate. I'm going to be a houseman. What's going to happen? So for the first 1 or 2 years, or up till 3 years, I can say I was in this denial phase. I was just avoiding it. I didn't think about it at all because I spent my whole life in Malaysia, so I didn't think that any day I was going to leave Malaysia. So honestly, I was in denial. I completely ignored this fact until the end of about year 4, year 5. I skip the anger. I go straight to bargaining, and I'll show you what I mean by bargaining. Depression, probably went through some depression as well, and acceptance. I think you all should also notice that the grief cycle is not linear. It doesn't go in a straight path. People can actually jump from different stages to the other. Just some brief psychiatry plot lecture. Okay, so these are all the emails I started sending from the end of year 3, beginning of year 4, from 2017. So this is me when I was doing my bargaining phase. So I think if you can see here, I send emails to GMC. I send email to SMC. SMC is Singapore. So first I tried, what else I tried to do? First I tried to email SPA. So SPA is the Suruhanjaya Penjawatan Awam. That's the one who is responsible for housemen in Malaysia. I tried to bargain with them. They told me no, there's no chance. After I failed Malaysia, after that I tried to message UM and UKM as well to try and ask if they will take foreign housemen in their hospitals. They also told me no, go away. After Malaysia, I expand my circle a bit. I said, okay, let me try Singapore. So I tried to email Singapore as well. Singapore also told me. So Singapore, they will only take UM and UKM graduates. By the way, I think USM, I don't know, but definitely UM and UKM graduates. Just some information for you. They won't take UAE graduates, unfortunately. So I messaged Singapore. They told me no. I went a bit further. I messaged Brunei. They also told me no. At one point, I even tried to contact Hong Kong Medical Council. I really didn't want to go back to Sudan, so I tried to avoid anywhere. I tried to stay close to Malaysia. Hong Kong, what else I have sent here? GMC is obviously the UK one. This one, ADHB, if you can see in the middle there, that's New Zealand. I tried to message New Zealand as well. So they didn't say no, but the exam was very difficult and very expensive. Immediately, I couldn't do it. And Canada as well. So to be honest, I have literally looked at every viable option that is an English speaking country or that I can possibly go to. I can tell you honestly, I've looked through everything. So hopefully you don't have to go through all this. But it was a very long process and I had to talk to a lot of people. So that's the first part. So the first part of the journey is over, which is we are still in Malaysia, starting to think about what to do. Next is the pathway to UK, and I mentioned briefly as well as other countries. So like I said earlier, we will talk about the academic requirements, financial requirements, and the timing. The important thing to note is that there are different pathways to reach the same goal. What that means is that there are like usually 3 or 4 different ways you can get registered. So the first thing you need to work in a different country as a doctor is you need to get registered with the medical council. Just like we have MMC in Malaysia, you have the GMC, which is for UK General Medical Council. You have AMC, Australian Medical Council. You have every country has their own one. Okay. So I'll talk more about UK. So these are the 4 pathways for the MC registration in the UK. We only need to focus on PLAB, to be honest, because the others are not really applicable to any of us. So PLAB is like an exam, which is like it's the licensing exam for international graduates trying to enter the UK. I think probably some of you, if you have all been interested about moving, you probably have looked this up. You've probably read about this before. So PLAB, I think, is the most straightforward route. It's the most common route people use. The second option actually is postgraduate qualification. What that means is if you can fully pass MRCP, MRCS, MRCOG, all those MRC exams, you can also get registration. That's a slightly, not more difficult, but it would take more time, I think. It's still a possibility for some people if you want to do it later, maybe while you're preparing your parallel pathway and so on in Malaysia. That's another option. The last 2 are very not really applicable to us, but I'll just mention them briefly. So sponsorship, which is something called MTI, the Medical Training Initiative, which is where the UK tries to give foreign graduates, like usually senior doctors, like 1 or 2 years experience in the UK. This is usually government to government sort of thing. So it's again not applicable to most of us. And the last one here, Caesar. So this is for consultants. And if you can read the last line there, So documents proving that you have the equivalent training of UK consultant, 800 to 1,000 pages. Basically, if you can bring your logbook from the time you were houseman until you're consultant, and you can prove to them that you have all the things, they will also sign you up. Again, it's all just mentioning for you to know, but PLAB is the one we're going to focus on today. Okay, so the road to UK really starts with PLAB. And I also put here UK MLA, which I will mention as we'll talk about. So the first exam is PLAB. So there's two parts to the PLAB. There's PLAB 1 and PLAB 2. Each of these is about 3 hours. So PLAB 1 is 3 hours and PLAB 2 is 3 hours. PLAB 1 is like a theory exam. And I'll also give some examples so we can have a look. But basically, PLAB 1 I would say is about the level of pro exam. And to be honest, if you have done mini tests in UIA, you know how hard mini test is. I think if you can pass any mini test, you can pass PLAB 1. That's, I can tell you that. You can take my word for that. And PLAB 2 is more OSCE based. So OSCE based, this is the one that I struggled, not struggle, but a bit more difficult for me at least. I know you guys now you're having more OSCEs, but for us, we only had OSCE in FAMAT. We only did it 1 or 2 times. It was very, very brief. So it was a bit new, different for me. I had to practice quite a bit for it. So these are the two exams. The last thing I mentioned is UKMLA. Now, what is UKMLA? It's going to come. It's called the United Kingdom Medical Licensing Assessment, which is more or less the same as USMLE. They're just trying to make it a UK version. They've been talking about this for many years now. Since 2017, the GMC, General Medical Council, has stated that they're going to start this UKMLA. The point being that they want to unionize, not or like satukan or standardize. Sorry, all the doctors, because there's some patients who are voicing concerns about the doctors' quality and so on. So for all the doctors, UK doctors, international doctors, where they will all have to pass the same exam in order to qualify. Again, like I said, they mentioned this in 2017, and I've talked to some local UK medical students. They said since like 10, 20 years ago, they said they're going to do this. Until now, it's not been done. So I don't know how soon it's going to be. The last time I heard was it's supposed to be this year, but it got postponed because of COVID to 2024. So I'm just mentioning this because I think it's important for you to know, because nobody really knows what that's going to look like. And for PLAB 1, PLAB 2, at least you have a lot of past year compilations. We don't have compilations for UKMLA. Okay. Now we're going to look at some of the questions that are PLAB 1 questions. So you can have a read through, and I'm going to make you guys answer these questions now, just so you can see how easy/hard it is. So first question, 22-year-old man, acute painful red right eye, blurring of vision one day, similar symptoms 1 year ago, episodic back pain, stiffness, relief by exercise, and diclofenac for 4 years. What is the most likely cause? Conjunctivitis, was it choroidititis, episcleritis, iritis, keratitis? Okay, somebody has to answer this question. I think it's quite easy, and you're all going for pro exam soon. So somebody tell me what's the answer.
Come on, guys. Anyone other than the moderator? Yeah, right. Hakimi
See,
answered C.
anybody else? Yeah, I can see the chat. Anybody else? Any other questions? C also. Okay. To be honest, I'm not sure. I didn't study, but I think this is a case of ankylosing spondylitis. Yeah, so I think it's a case of ankylosing spondylitis, which I think should be associated with iritis, which is anterior uveitis. So I mean, to be honest, all the eye symptoms for me are the same. I can't differentiate. Yeah, I think RIFD. I think RIFD is correct, but don't quote me. You guys should know this more than me. I look all my medical school stuff. For me now, work is I just go to work. I put cannula in patient. I just do the round. I forgot all these things. But I think it's D. I think it's D, anterior uveitis, or also known as iritis. So the point is, this kind of questions that you can see is very spot diagnosis kind of question. I want you to think about this because it's going to, when we look at USMLE, it's a bit different, the US punya exam. You can keep reading through these questions. It's just to give you an example of how easy/difficult it is. I'll give you like 1 minute to read some of the questions and try to see if you can answer. Actually, let's try number 3. Actually, let's see. A healthy baby boy born at term to a mother who was woman who was unwell with confirmed acute hepatitis B during pregnancy. Mother is very concerned. She may have affected the baby. What is the single preventative intervention? Full course Hep B vaccine, Hep B immunoglobulin alone, Hep B vaccine and immunoglobulin, Hep B vaccine single dose, or none of the above until Hep status. Okay. This one ONG. Who wants to be an ONG? You need to know this. You can put your answers as well in the box, guys. If no answers, I'm going to report to Prof. Hamiza. She's still the head of department. I will report to her. That's all that's going to happen. And you're going to get extended. And you're going to make you repeat the pro exam again. Come on. I'm not going to move until somebody answers this. Hep B, guys. Asline, what do you think?
Oh, I
You,
would like to I would like to pass this to Alif Aiman. He presented about the slides.
oh, okay. Is he here?
Alif is here.
He
No, I
presented, but
think
you should be listening.
I think it is C, combination of both. I'm immunoglobulin as well as vaccine.
Yes, thank you, Alif. Yeah, that's correct. So I think you can see most of the questions I think are relatively straightforward. They're not confusing. They're just like straight to the point. I honestly think you tell me I am year five MCQ is not harder than this. I think I am, and we have negative marking. This exam is not negative marking, it's single best answer, no true false. So I think UIA has really prepared all of us very well for any future exams. And so on. Okay. Moving on, I will show you next the PLAB 2 sort of scenarios. Oh, sorry. And last thing I want to mention is that when I was preparing for this, I think the thing I struggled with a little bit was maybe they have a few questions about like alcohol withdrawal, alcohol dependence, these kind of things we don't learn so much in UIA or in Malaysia generally. So that one I had to revise a bit. Everything else was the same. Just I think a bit of the alcohol, some of the mental health. They have like mental health act we need to know. And for me, I always struggle with comment. So they have some comment questions like biostatistics and things like that. Okay, this is PLAB 2. So this is taken from the GMC website. They do the PLAB exam. So you can see here's a sample. You will be in a mock consultation. I think it's just like the FAMAT OSCE scenario. So you are foundation year 2 doctor. So that's like means like a houseman, second year houseman in GP, general practice. You seeing a patient, James, 45, having pain in the head, no other information. You're asked to assess, manage. So you have like 8 minutes, yeah, to take history from the patient, examine, and so on. And then it's like OSCE. So they just see how you interact with the patient. So they will bring a simulated patient and you have to ask them, get the history, and so on. And the examiner is looking for, it's just all again very OSCE based. So I think you guys should, I heard you guys doing OSCE more now, so I think it's probably more relevant for you guys. They want to see how your data gathering skills, clinical management skills, and interpersonal skills. So how you communicate, your empathy, and so on. And here are some other, on the right, some of the other scenarios that are usually there. Sometimes there's an angry patient complaint, breaking bad news, counseling, misdiagnosis, angry relative, and so on. Which, to be honest, when I was studying for this, I thought most of this was quite silly because I mean, I have no exposure to this before. But when I started working here, a lot of these scenarios they are doing is actually based on real clinical practice. So a lot of these things actually happened to me after I started working, and you'll be quite surprised. So it's actually quite a good exam, I think, that it reflects the real scenario in the UK. Okay, I'm going to break for a while. Now we're going to start the second part of my journey. Are there any questions up until this point? Just give me.
Musaab, actually, I have a question. So
Yeah,
when
go
it
ahead.
comes to lab two, right? So is it like 8 minutes only for history taking, or is it with the examination and everything?
Okay. Sorry, that's a good question. So is there will be like 16 stations. Okay, so the whole thing is 3 hours. I think there'll be 15, 16 stations. It's 8 minutes per station. So some stations can just be history taking, some will be history plus examination. So you have to like combine both. Some will be 8 minutes just counseling. Some will be 8 minutes examination, just examination. They will give mannequin. So it depends on the scenario, but the time basically it's 8 minutes, and then yeah, there's no discussion with the examiner. It's not like a short case. But sometimes they can be okay. They'll give you like you have in the last, they will say in the last 2 minutes, please discuss your differential with the doctor there or something. But very rarely, it's like one or two of the stations. But yeah, generally speaking, every station is 8 minutes. It's just there are different tasks to be accomplished in those 8 minutes. Thank you.
All right, understood. Thank you very much. Anyone else have any questions? We can just give about 30 seconds if anyone has any, or you can always put it in the chat box.
Yeah. Okay, I don't think so anyway. Let's move on. That's fine. Oh, there one, sorry. Apart from past year question, any additional resources? Okay, so I will share at the end my references. But to be honest, I found, especially for PLAB 1, so PLAB 1, like I said, it's a theory exam, just MCQ. I found that just the past years was more than enough. I had to revise, like I said, just a few topics like the alcohol, because we never learned that before, so I had to go study from the internet and so on. But the most important resources, the past year. I think the past years will be the most helpful. I think more than 50% questions are from past years, at least during my time. I hope it didn't change. From resources, from the past year questions. The NICE guidelines. I know you guys have used NICE guidelines before, but basically, if you want to use any other resources, it will be in NICE guidelines. I hope that answers your question, Akimi. For Inamol, okay, if you take MRCP 1 and 2, so that's why in the first slide, or not the first slide, but the one we talk about the pathways. So you can either do full PLAB route, PLAB 1, PLAB 2, or you have to do full MRCP route. So MRCP, you have to do MRCP part 1, MRCP part 2, and PACES. So I think, I don't know if you know, but part 2, MRCP has actually 3 parts. So part 2, written and PACES. So you have to get the full MRCP registration. If you do the full MRCP, you don't need to do PLAB 1, PLAB 2, but you cannot do half-half. You cannot like mix and match. It's not a breakfast or lunch set. You can mix and match. What else? Oh, RIFD, okay, venue of the exam. So I will come to that in a bit. Yes, we will talk about the venue of the exam. So just hold on there. We will get to that point. All right. I'm going to move on now for the second part of the journey. So this I hope you guys know this. I don't think you might know this. So people who live in KL, you might know this venue. This is British Council in facing KLCC. So this is where I had to do the IELTS exam. So the first step actually before the PLAB is actually IELTS exam. After IELTS exam, you have to do your professional. For me, I did my pro exam, and then only I did the PLAB one. Okay, why I want to talk about this part is actually when I started this journey at the time, again, like I said, I was alone, I was doing this alone, and actually quite a lot of things happened to me lah. So I will show you some of the emails to show what happened to me. Okay, so this is me on the March 2018. So I was supposed to sit for the exam on the next day, on Friday, and I lost my passport. So you cannot enter the exam without your passport, at least for me, because I have no other ID. So I could not enter the exam without my passport. They wouldn't let me use license. They wouldn't let me use anything. They said you have to use your passport. So I had to cancel the exam. And because I'm from Sudan, so I had to fly back to Sudan to make a new passport and then come back to Malaysia. I even remember this happened. Like I said, this was the end of year 5. I was doing my IM posting that time. I didn't tell anybody where I'm going. I just left for like 1 week. I remember it was Dr. Che Rosley's class. I messaged him. I won't be here for some of your classes. It was very stressful. So I had to fly, make a new passport, try to come back. I tried to get the passport. I tried to use cable. I know the Malaysians use this term. So I tried to use cable. I think maybe Allah punished me for that. I tried to get the passport on the same day. It got even delayed even more. I had to stay 2 or 3 days, postpone the ticket and so on. So it was the beginning of the journey was already very, very rocky for me. Anyway, alhamdulillah, got the passport, came back, attended my class. Again, nobody knew what I was doing at the time. And then I booked my exam again. But I just want you to focus on the date of this. So I know you guys, pro exam now is November, but it used to be August. Actually, for me, pro exam was on around the 1st of August or the end of December. So I was going to sit for IELTS literally 2 weeks before my pro exam. Again, I think most people didn't know. I went to KL like a weekend, Thursday, Friday, Saturday, and came back on Sunday. It was very, very stressful. Anyway, so that's the IELTS done, and then this part of the journey is done. Okay, after the IELTS, I had my final pro exam, which was 2018. So there's a lot of pictures. sorry, I could choose from, but I just start with this one because I know you guys, your pro exam is changed now, but it's how it used to be. We used to have MCQ, OBA, PMP, long case, short case. Okay, I'm going to ask another question here. I want you to tell me what is the most common activity done by medical students after pro exam. I think you guys also will be doing, fifth year will be doing this activity soon, or probably already start doing this activity now. Traveling, or this is a single person's answer. Sad. No, it's not traveling.
Wedding.
Wedding, yeah. So let me show you. While everybody was happy getting all this card jemputan, literally after pro exam, all these card jemputan start coming in the Facebook group. I was studying for my exam, for PLAB exam in October. Anyway, that's just something to keep in mind. All right. Okay, now I want to talk about what the international students. Okay, but I didn't know most of you, the locals, are also going to be looking for this. But yeah, it's applicable to everybody. What can you expect after UIA? So to be honest, life in UIA, I think life up until you are in UIA, at least for me, I think is very, very structured. Every day you know what's going to happen tomorrow. Like you know you masuk medical school, you're going to be there for 5 years. You know esok you bangun, you're going to class. You know if you see Dr. Nick Noon in your exam, she's going to scold you. Everything is very, very fixed. You're not worried about anything. There's a certain calm to knowing everything going to happen. But up until that point, after that point, everything is like completely out of the blue. You don't know what's going to happen next every day. You wake up tomorrow, you don't know what's going to happen. At least that's for me. That's what I felt. So my advice is you need to prepare early. So for me personally, like I said, I was in denial. So the first 3-4 years, I didn't know anything. I didn't look. I didn't try to find out and more, which is obviously not a good defense mechanism, lah. But my regret, not regret, but if I could, I would have started preparing earlier. Expect the unexpected. Like I've already shown you, and I will show you some more examples, but I've already shown you that a lot of things can go wrong. So for me, I started the journey. I thought simple is I'm going to take my IELTS, should be simple, come back, go home, simple. Lost my passport, had to fly back, had to come back. A lot of things can go wrong. Contingency plans. I think it's important to have a plan B, plan C, plan D. So for me personally, like I said, I've contacted all the medical councils. I wanted to know how to register with everybody, Australia, Ireland, Canada. I had a few backup plans in place anyway. And the next is culture shock. So life in UIA, life in Malaysia, life wherever you are, it's a certain way. You're very protected. Once you go outside, it's really like you're entering adult life properly. I think up until here, you can still say you're not really adult life. Once you leave, everything changes. Life moves very fast. No support. Like I said, you will find that you will be alone for most of what you're going through. Like I said, I was the only foreigner in my batch. So everybody else was, nobody else could help me, to be honest, throughout all this lah. So you have to support yourself. But you can always have faith in Allah. He is the best planner. And I want to share this doctor. This is Dr. Iman Abisurur. So when I was starting to have to find out more about what I have to do, Dr. Mai, I don't know if you guys know Dr. Mai, she teaches physiology, BMS. So this was one of her batchmates. So she told me, hey, Musaab, because I told her, oh, I'm not sure I'm going to do after this, because I'm very close with her. So she told me, oh, one of my batchmates was this Moroccan doctor, Dr. Iman. And after she graduated, she did some exam in Singapore and something, and then she went to US. So I contacted, so you can see here down here in her education, here she says graduated in UIA, somewhere down there. International Islamic University in Malaysia, Kuantan. And after that, she went to Harvard. So there is high hope. It's not. I didn't go to Harvard, but there is still hope for some of you if you want to. From UIA, you can go to Harvard. That pathway exists. And I contacted her actually to try and find out what this exam she did was in Singapore. So it turns out actually she is a US citizen. So what she did is, at the time Malaysia didn't have USMLE exams. We have now, which I will talk about later, the venue and so on. So she went to Singapore, she did her USMLE, and then later she went to US and became a consultant there. And she told me a bit about about how to prepare for the exam. It was really helpful. But I think she was very well prepared compared to me. I think she knew what she was doing and she knew what to expect compared to me. Okay. Now we're coming to next part, which is NHS experience. So this is the hospital I work at now. It's called Queen's Hospital. You will see all the hospitals here, they name after the Queen. So it's not just one Queen's Hospital. All of them are called Queen's Hospital. All the hospital are her hospitals. And this is my timetable, more or less. I don't know if you can see it very clearly, but most of my days are 8 to 4. So this is the first thing I want to mention. Life in NHS compared to KKM is very, very relaxed. 8 to 4, I know houseman in Malaysia, you have to come at like what 5 o'clock, start doing pre-round with the MO, round with the specialist, all this. Here, no, you come one time, you do the round with the consultant, that's it. The consultant has to see for the first few weeks almost. I didn't examine single patient. During the round, the consultant will examine, consultant will read the note. You just sit there and type what they want. Very relaxed. 4 p.m. finish, go home. Nothing there is no reason for you to stay after 4 o'clock. Anything you didn't do, you hand over to the next doctor. There's somebody else waiting there to cover. So very relaxed. Sometimes I work 12 to 10. It is the blue spots there, and their on-call shift. I'm putting quote fingers because this on-call is just night shift. It's just a normal night shift from 9 p.m. to 9 a.m. and that's it. This is the whole timetable for UK. This is some of the duties I have to do. So this on the right you can see. So at 10 handover in the morning. Clerk patients. So sometimes not sometimes, but patient referred from ED, we clerk, and then we help with some procedures, discharge letters. Very simple. The thing only is at night. At night, work is a bit more, not a bit more, but basically what happens is they will leave one doctor to cover 4 or 5 wards. So anything, the nurses will call you. So this means any patient deteriorate, any patient needs anything to be done, you need to do. So at night, it's a bit more hectic because they don't have as good coverage at night as we do in Malaysia. Yeah, so this is just a general overview of what NHS experience has been for me. This is a very good quote that I found because I felt the same thing after I worked here for a few months. The NHS is the closest thing the English have to religion. What that means is they are very protective of the NHS, which at the same time means they are very grateful. So all the patients, most of the doctors, at least the local doctors, they are very proud to work in NHS. The patients, almost every day, I would guess may say, "Oh, thank you NHS." It's almost as if they're saying, "Oh, thank you Allah," like, "Oh, thank you NHS is the one that saved me." It's very fanatical. It's very interesting to see they're very, very dependent on it. And if you work for it, they will also see you like as if you are the imam of the religion. They will be like, "Oh, thank you, doctor." They're very respectful and so on. It's very interesting. This is the GMC. Again, more about how the NHS work is that they are very, very, very formal. So they have this something called the good medical practice. So almost every day you will hear somebody say this word, good medical practice, good medical practice. They are very have to follow medical council rules. They won't do anything that is outside the book, and it's very, very strict as well in that sense. Again, which aligns with the part that is like the religion. This is their script. They have to follow the script. They will very rarely veer off the script. They're very, very crazy in that sense. This is more about NHS. So this is something that happened a few years ago in 2016. On the left, this picture. So they had a big hartal, a big strike, where they felt that the doctors were working too much. So after that or around that time, it was successful. So for 1 week, I think they went on strike. It was very successful, and they managed to get their working hours reduced to 48 hours per week. I don't know how else to emphasize to you. 48 hours per week compared to Malaysian HO or IMO. I think Malaysia working at least 70 plus hours per week. 40 hours per week is like 5 days a week. You work like, I don't know how like 9 hours, 8 to 4, 5 days a week. That's it. And sometimes on weekends. It's very little hours. And it's just, that for me, that blows my mind personally. I even have like an interesting story about this. So this 40 hours per week is your contracted hours. Hospital cannot make you work more than this by force. But if you want to work more, you want to do extra hours, locum, you can. So what happened to me when I first came, because I'm living alone, I had nothing else to do, I tried to do a lot of locums. And then at one point, even the hospital director, not hospital director, but the person who's in charge of the staffing, they messaged me back. They were like, "You have worked too much. You need to rest." And I don't think anybody would ever say that to me in any other country. They were telling me, "Oh, you've worked too much. You need to rest. You have to have 12 hours rest every 12 hours." I was like, okay, I never had that in my whole life. I don't think I need that now. But anyway, legally they won't let you work more than 12 hours in a week. More than 12 hours every 24 hours. The negative side of that, I think since that happened, they are a bit understaffed because it's hard to cover. That's why you get night shift. You can be alone covering 4 or 5 wards. And then look on the right here. Every year they have this article coming out. Oh, NHS is in code black alert. Hospital are full. What can we do? Every year, and I've been here 1 year. Every day I'm hearing this. Hospital is full. Hospital is full. Beds are full. Patients are full. I don't know if it's going to change anytime soon, especially now with COVID. The waiting lists are very long. So for elective operations, for cancer operations, so it's quite a big problem in the news. A lot of patients are angry. All the community is quite angry these days because a lot of things have been pushed back. And another example of how they are very strict as well is that now they have in the emergency department in the ED, they have something called breach time, which means they have 4 hours. Any patient who comes in must have a decision within 4 hours. They're going to be admitted, referred, or discharged. And again, there's a lot of these administrative things they try to do, which puts a bit of stress on everybody at the same time. Okay, so another break, not break, but another chance for you to ask questions before I move on to part 3 of what's happened to me after that. Any questions?
So guys, you guys can ask questions. Like just open up your mic, or you can type it down in the chat box. But just to summarize, it really feels like NHS is like a heaven for all doctors. Like they are asking you not to work, and then you are like they are protecting you in a way. Like it's really different from what is expected in Malaysia, right?
Yeah, definitely. So that's why I said at the beginning of my presentation, I said I hope that even if you don't come to UK or you don't leave, I hope you can stay and fight for Malaysia and make it better. I mean, you have to balance the pros and cons at the same time. I mean, you can say it's heaven. Yeah, I agree with that. But I mean, it seems to me like how is it possible that the doctor can work only 8 to 4? I don't think medicine is ever meant to be 8 to 4 job. Again, it's different people have different views, but I don't think medicine was ever meant to be 8 to 4. It seems irresponsible. It seems very weird to me. But I mean, if you want easy life, definitely it's in terms of easiness, it's very easy. But I don't know, maybe it's just my fit not fitra, but this is the way I live in Malaysia. I saw the HO in clinical years. I cannot imagine doctor being anything other than that, which maybe is something wrong from me. I don't know. I'm not here to judge. It's up to anybody to make that decision.
Right. So like that is like the sense of responsibility of a doctor. The burden on the doctors, right? Like which they have to carry. I guess that's what you're trying to say, right?
A little bit, yeah, a little bit. That's what I'm trying to say.
All right.
But yeah, I mean,
Oh, yep.
yeah, no, that's fine. I guess there's no question, so I'll just move on. It's okay. If you can ask
All
at the
right.
end, if anything. I
All right.
just worry people have a lot of things to ask, but that's okay. So next part of the journey. So now I have done. Oh, not sure if I mentioned earlier. So after IELTS, I did my pro exam. While everybody was busy getting married, I studied for my PLAB one. So pro exam was August. I went to Sudan in November. Not November, sorry, September. I did my PLAB one there in October, and alhamdulillah, I passed. So next part of my story is best described in a few pictures. So this is me doing housemanship in Sudan. So all my attempts to do housemanship somewhere else failed, as I showed you earlier. I couldn't get to go Singapore, Brunei, all this country. They wouldn't let me. So this is the first picture on the left is actually an underwater chest tube. This is a chest tube in a third world country, basically. So this is an underwater seal. You can see there the hemothorax coming out, and then the water bottle there is acting as the underwater seal. I thought that was very, very cool for me. The second picture on the bottom left, is the emergency department. This is where I was doing my surgical posting. And yeah, this is the ED lah. This is the surgical ED. This is where they just bring the patient, they put them on this bed over there. This guy they brought him to me at night. I was doing on call alone, got stabbed in his kidney. And there was nobody there to stabilize. So I just did A, B, C, D, E lah. but it was very next day went to theater and so on. But this is the image department. It was crazy. Third picture, top middle. This is I'm not sure if you can read this, but it says here Tabib Mudrib, which is again on strike in Sudan. They always go on strike every week, but there is no outcome. Like they just go on strike, but no outcome. So I had to wear this tag which show like I'm harta lah. Basically, I only see emergency cases. Bottom middle, this we got a call that there is like a bus accident, and again the ED is only one bed, so they put all these beds here for us to do triage. They will just put the patient on the bed down on the floor, and they ask you to see, okay, ni tengok ni who is for resus, who is to be moved out and so on. And then after a few other things, alhamdulillah, this is me flying to Manchester, which is where I have my plab exam, the top right, plab 2. And if there's any Liverpool fans, yeah, this is a picture of Liverpool for you. Because when I first came, I stayed in Liverpool when I was in UK. Okay, so a few things also happened. So around this time, or after I graduated, Brexit happened. Why this is important is I tried to apply to UK for housemanship as well. But the way is because that time Brexit not yet happened. That was around before 2018. Brexit didn't happen yet. So what Brexit means is that because of the EU, the preference for job is first to the UK and EU doctors, then only to everybody else. So I couldn't get a job as a houseman there because there's like they said, oh no, we have to give prioritize to EU residents first. So that's why I couldn't do housemanship there. I had to do housemanship in Sudan. But the second picture, bottom right there, so they changed that rule right after Brexit, I think around early 2019. So they changed that rule. So they removed the restriction so everybody can apply together. So this was a blessing because it meant that I could then go easier to the UK. Okay, and another series of emails. You can see what happened to me. So I tried to interview actually for a job while I was still doing my housemanship. So there was an opportunity, something opened up, which is called WAST. So I'll talk about this a bit as well later. It's called Widening Access to Specialty Training. So again, like I said, this was around Brexit time. So the first thing you can see here in the email, it says we have to give preference to the EU doctors. It says in the third paragraph, UK law dictates when applying appointed candidates, we must consider applicants who are not subject to the resident labour market test, which means the EU candidates first lah. So I got hit by this rule until they changed it. And then next email I got, okay, they around this time I think Brexit happened. They were like, okay, now we're opening the chance to you, and they offered me the chance to do interview in Dubai because I couldn't get the visa to go to UK. So I went to Dubai and I did the interview, and alhamdulillah I passed the interview. They said, okay, as soon as you pass your plab, we will give you a job. So this was like, again, it was very crazy for me that they already offered me the job before I even like have registered. They told me as long as you pass your plab, we will get you have a job waiting for you in UK. I just want you to focus on this next series of emails. Look at the date. So this was March 2020, and we all know what happened in March 2020, COVID. So what happened to me actually, right? As I was about to fly, I was literally supposed to fly on this date. I had like fever and URTI symptoms and so on. At this time, we didn't know it's COVID. Actually, I thought I had measles. I don't know again whether it was COVID or not, but yeah, I had fever. I couldn't fly. So because I couldn't fly, I couldn't sit for the exam in time. My job offer was like postponed. They told me, okay, because you cannot come, the job offer is postponed again. So I'm just showing you again, you have to expect unexpected. When I started this journey, I already got trouble with my IELTS, my passport got lost, everything happened. And then again, now the next step, I was almost at the door. I'm like, okay, I'm going to leave now. And then this happened. Until now, I'm not really sure what the hikmah of all this is, but I'm sure there's a hikmah somewhere. I can just theorize on some things. I think maybe at that time it wasn't the right time for me to go to the UK yet. I got to stay with my family in Sudan, which I hadn't been with for a long time. I was there with my grandfather when he passed away. And if I had gone to UK, I would have worked during COVID, and I don't know, maybe I could have gotten COVID or something like that. But I think, like I say, Allah is the best planner. So I think all these postponements happen for a reason, and at the end I'm grateful for everything. Okay, next part we're going to talk about is the specialty training in the UK. So we're going to talk about how to access training. So this is a nice infographic. So on the right box, UK graduates. So if the UK graduates, what they do is they straight away they enter the housemanship FY1, which is like the first year of housemanship. and then they move to second, this orange box, F2, FY2, or second year housemanship. So for us on the left, we are on from the left side. So IMG means international medical graduate. Anybody who graduated from overseas. So you can either try to enter FY1, which I tried to do, but at the time Brexit, so I couldn't do. But now it's possible. And then you can either do your housemanship overseas, either 1 or 2 years. It doesn't have to be the full 2 years. And then you can apply. You have three pathways. You can either apply for F2. You can try to apply for housemanship with the UK graduates in the second year. You can do this WAST, which is what I tried. I got an interview for. Actually, WAST is actually only for GP and psychiatry. So at that time I was quite desperate. So I said I would just do this job and I will think about later what I need to do. Which again, maybe the reason why I didn't get this job, because I honestly I wouldn't do GP or psychiatry, to be honest. And then the last one, which is what I ended up doing, it's a non-training job. Non-training job is basically like service MO. So you work as service MO, and then you have to sign this form called CREST, which is Certificate of Readiness to Enter Specialty Training. And at the end, all three of us can enter specialty training, which is called CT1 or ST1, which is Core Training 1 or Specialty Training 1. This is just the overview of the pathway. Okay, now I'm going to talk about, I think it's maybe the most important slide, maybe. We're going to talk about how the training is in the UK. I hope you can see this clearly. If you can't, just let me know. So this is how surgical training I'll just mention about surgical training, medical training, and radiological training. But I mean, basically surgical will be the same as, more or less same as ONG, medical, more or less as PEDS and so on. So surgical training in the UK, if you can read the first box up here. So neurosurgery and cardiothoracic surgery, they have a separate pathway. The important thing to note is 18 months. If you work more than 18 months in surgery, you cannot apply for core surgical training. So the way they structure their training is there's like 2 phases. You can apply for core training, which is like 2 years. They just teach you all general surgery. So you rotate through all the posting. You have to do surgical, orthopedic, uro, and so on. And then there's like a higher training, which is where you choose. You want to do orthopedic, vascular, and so on. So if you have worked more than 18 months as a MO, surgery means post housemanship lah. If you've done as a MO lah, or as anything else, then you're not allowed to apply for core training. I don't know what the reason for this is. I don't know if they're thinking that it's harder to make you to retrain you. Like maybe they think you already know things in certain ways, so it's harder. So they don't want to retrain people. I don't know. But you can apply for higher training. You have to choose. You either do vascular, orthopedic, or so on. Anyway, so your training is year 1, year 2. And you have to do the MRCS. You have to get the full MRCS. So you have to do full MRCS before you can go into the higher training. And then you have to be interviewed again and apply for vascular, orthopedic, and so on. This training is really about up to about 6 years. So up until ST8. So that means you have taken 8 years, about 6 to 8 years. That depends on certain specialties, how long it takes. And then you can do fellowship after that. Next is medical. So this, I know more about this because I'm doing this. I'm going to do this soon, inshallah. So same thing. You applied for the training from the beginning, from earlier with your PLAB also on non-training job, like we did in the previous slide. And then you're going to do IMT1, IMT2, IMT3. IMT means internal medicine training, 1, 2, or 3. 1, 2, and 3. You're going to do 3 years. There's also something called ACCS. I mean, that's a bit. I don't think you need to get into that, but basically it's a more acute training where they will make you rotate through ICU and anesthesia, but it's 4 years instead of 3 years. Anyway, the point is after those 3 years, you're doing all your rotations, you're going to rotate through all the postings, neuro, renal, and so on, and then you have to do your full MRCP. Now, this is a surprise to me that actually I understood in Malaysia. I think we all understand that MRCP means you're a consultant. Actually, in the UK, it's not the case. MRCP is just for you to enter the higher training. Basically, just to be a registrar. Just to be like a senior MO, you need the full MRCP. So MRCP will not make you a consultant in the UK. Anyway, after that, you do your training, which is usually 4 to 5 years. So you do either, you do neuro. At this point, you interview for your second training, either neuro, cardio, renal, or so on. I think it's actually around, usually 4 to 5 years. And at that time, you will get certified in IM and in whatever you chose to do, neuro or cardio or so on. Lastly is radiology, which I think is a bit interesting as well, if you want to do it. So again, same thing, you apply for interview at the beginning, if you pass the interview and so on. So I'll show you the process a bit earlier, but you have to interview, you have to show your portfolio, CV, and so on. If they choose you, you can enter the training. So training for radiology is a run through. Run through means it's just straightforward. So you don't have to interview again later. So it's just 5 or 6 years, 5 or 6 years, and you pass your FRCR throughout this, which is the Fellow for Royal College of Radiologists. And it's a 6 year. If you want to do interventional radiology, you can do a 6 year, but generally it's just 5 years lah. So it's shorter than all the other surgical and medicine. Surgical will be like 6-7 years. Medicine will be at least 7 to 8 years lah. Yeah. Okay. This is the next thing which is important to know about specialty training, which I think it's important to know this now, because you need to decide what you want to do early on, and then you need to know how hard is it to enter. So this is the competition ratios, which shows for different specialties. So it's basically a ratio of how many people applying for a certain job. So for emergency medicine, there is about 3.8. The thing to notice to focus here is cardiothoracic and neurosurgery. It's almost impossible for international students to get in to those two specialties, because they have very limited numbers. They have only few major centers doing it, like only 4 or 5 centers doing it, so they don't have that many trainees for it. The ratio there is, you can see that 18 or 20, up to 18, 20. Basically, that means that up to 20 people interview, they only choose one person. I'm not saying it's impossible, but unless you are confident that you can beat people for Cambridge and Oxford, those people are doing like masters in their medical school. They're doing like MSc in 3 years and 4 years. So you can just imagine their CV is very, very good, and they are preparing for this from the first day they enter medical school. It's not impossible, but just you need to know the reality. Other things like IM is a bit easier, 2.2. GP is also quite easy, 1.79. Ophthalmology, 6, and so on. And I'm going to show you some of the requirements to enter. Let me just. Okay, yeah. Sorry. Okay, so this is called the person specification. So this is the list, which I found very, very good about the UK, is that they have very clear criteria for every specialty. So they will show you every specialty what they expect, or how you can pass the interview, or what they want to see from you. I will put this link there later in the references. You can look for it later if you want. But yeah, you can. I will also show this later. So acute medicine, anesthesia, space medicine, cardiothoracic. They have everything. They list everything that they expect. It's called person specifications. What they expect the person to be like in order for them to choose them, basically uh, for that specialty. Okay, let's go back to the presentation. Sorry. Oh. Sorry, some technical difficulties. I'm not very tech savvy with all this Google Zoom meets things. Okay. Okay. Sorry. Is that? Can you see that? Are you back?
Not yet, bro.
Yeah. Okay. Okay. Sorry. Yeah. Now.
Yep. You can see now.
Okay. Okay. Again, just gonna briefly mention the training. So 2 years housemanship, 3 years stage 1 training, 3 or 4 years, and you have to do your MRCP in this time. And then the last one is the higher training is 4 years, and then at that point you get your CCT, which means certificate of completion of training. A bit of mention for GP training as well. So GP training is actually much easier in the UK, and I will talk more later. It's actually quite financially lucrative lah. So again, F1, F2, first 2 years, and then you just do GP training for 3 years. At the end of the 3 years, you are a GP consultant. So you get the consultant salary lah after 3 years, compared to all the other specialties which take 7, 8 years and so on. Okay, so I'm gonna go briefly through the criteria for internal medicine and for surgery. So this is the internal medicine training. Can you see the PDF? So it's just the MBBS. Obviously, you have to have work for at least 12 months in the UK or anywhere else, and you have this form. So you can actually work in Malaysia. You can come straight into training in the UK. If you do your housemanship there, and you can straight away apply for training from there. It's possible. Like, you don't have to work in NHS first. But the more important thing to focus on is down here. So these are the more selection criteria. Is how they choose people. It's very clear guidelines. They say, okay, if you have MRCP, it's desirable. It's not essential. It's desirable. And other degrees, if you have MSc, BSc, and so on. Clinical skills, during interview they will ask you like clinical questions, see how good you are. More on research as well. So here, essential, they expect you to know research, and if you have done research, you can show that you have done any presentation, any poster, or so on. Again, that will help you. Teaching, they need to show that you have done teaching before. So either you teach medical students, or I think you can use the prime if you've done prime before. I just put all of that in line the CV. Personal skills, everything is very detailed. What they expect from you, they want you to ideally to have some leadership skills. So if you've done things in medical school, even you can mention that. Voluntary work, achievement outside of medicine, organizational skills. So they're very, very detailed. As the point I'm trying to say, they will assess all of this during the interview. Okay. Back to this, and we're going to have a look at surgical training as well. Again, all this is available on the internet, but I'm just showing it to you now so you can have an idea. But this is the surgical training self-assessment. Again, very detailed criteria what they expect. Blah blah blah. Going down a bit further. So they even give you points. They tell you if you have passed MRCS, 4 points. If you have attended courses or so on, 4 points. So you basically, if you get all the points, there is no reason you shouldn't get the place basically lah. I like this compared to like in Malaysia. I think there's a problem where the people don't know what is the criteria to get selected for training and so on. But here is very clear. You have done cases, you have attended conferences, you have done elective in surgery, and so all these things will give you points. And at the end of the day, people who have the most points, they get in. Very, very, very simple. I think quite fair lah. Okay. Sorry. Moving on. A bit about US pathway. I think I know most. I mean, I don't know what you're going to do, but a bit about US pathway. Or so you can see, it's quite long. So it used to be step 1, which is basic medical sciences. It can take up to 4 to 10 months to prepare for it. It is like an 8-hour exam. It's like, I don't know how many questions, it's 8 hours like compared to that one earlier, which is 3 hours. And then you have to have a step 2 CK, which is clinical knowledge. Again, also 8 hours. It's not 8 hours straight, but you have to have 1 hour. You get break 15 minutes. 1 hour. It's a lot of questions. It's really a lot. And I wish we'll see the answers. We'll see the question samples later. The good thing is they cancel the step 2 CS, clinical skills. Now, because of COVID recently, they need to get more doctors, so they've canceled some things. So they have canceled the step 2 CS. Now you can just do step 1 and step 2 CK. You can go to US. And step 1 used to be score based, but now it's just pass fail. This is very important as well because it used to be very hard, because if you have a low score in your step 1, then it will affect your chances to get into training later. So now the focus is just on the step 2. You have to get a good score. Obviously, after that you do the exam, you have to get your registration. You have to have the OET. OET is an English exam. It's kind of like IELTS as well. And you have to do step 3. Step 3, you don't need to do it early. You can do it during your residency. So that's not important. So now it's just 2 exams. It used to be 3 exams, but now it's just the 2 exams. And then you apply for your matching and so on. Okay, this is the questions that you have in step 1. Very long. Immediately you can see compared to PLAB questions earlier. 27-year-old woman. Honestly, even I don't know what the answer. I mean, the answer is there, but I had no idea how I would answer this. 27-year-old woman, come for counseling, had a baby with neural tube defect, wants to decrease her risk. So it's very, like, a lot of steps you need to think about. decreased risk for condition, no history of medical illnesses, no abnormalities. What is appropriate to recommend? Begin supplementation with a vitamin, cofactor in which of the, oh my god, my head hurts just reading this question lah. Well done to you if you know the answer, but I have no idea what the answer is. It says here biosynthesis of nucleotides. I won't even try to explain that. On the right here, you can see what is the things they expect from step one candidates lah. They expect you to know a very detailed basic medical sciences, like in and out. Okay, this is step two CK, which is only step two now. So it's more about applying medical knowledge, skills, understanding. So 17-year-old girl come to the office. So again, very long questions. I mean, it only takes you time to read this. Compared to play exam, you can just, it's more or less spot diagnosis. Like you can just read the question, like, okay, this, you can go on. Tried to restrict her diet, backfires, becomes hungry, binge eating, loss of control, eaten 2 pizza. Basically, I think it's anorexia, basically, or bulimia or something. And now they're asking you for the serum studies. So you have to figure two things. You have to figure out what her potassium will be, what her bicarb will be. I mean, okay, it's a bit easier, but it still takes time to figure out lah. So obviously potassium will be low. I guess bicarb will be high because of acidosis, something. I don't know lah. I passed all this already. I don't need to know this. I don't want to think of all of this anyway now. Okay, a bit of a brief about other countries. So Australia have the AMC, Australian Medical Council. They have their own exams, also like a part 1 and a part 2. It's very hard, not very hard, but it's less resources available. Less people are doing this. They are, it's a bit more expensive. And another reason I didn't choose to do Australian exam is because if you actually do your PLAB exam, NHS, and you work in NHS for 2 years, you can then automatically go to Australia. You don't need to do any exams. So for me, that was like, why don't I just do that? At least I can do NHS first. If I don't like it, I can go to Australia later. The only thing is Australia, they have less chances for international doctors because they have quite good enough number of doctors. UK has quite a lack, but Australia not so much. And Canada. So Canada is more to American style system. So you have like, again, they used to have part 1, part 2, and then like a clinical exam. But now they have just changed it to part 1 and then there's NAC exam, which is like the clinical exam, I think. So just to show you that, again, they have also changed it. They used to have part 2, which they have cancelled now due to COVID. Ireland as well, they have their own exam. It's called PRESS. Ireland, the benefit is you can actually mix with the UK system. So you can do PLAB 1 and then you can go to Ireland. Yeah, I mean, you can go there, but training opportunities there are a lot less than UK. You'll just work as service MO for most of your time. Okay, this question earlier, where to take the exam. Okay, here on the left, this is the USMLE Center, Prometric Center. Is in KL. So you can do all the USMLE step 1, step 2, all of this OET, everything can be done in KL. It's here in somewhere in KL, around Damansara area. There, Wisma, wherever, yeah. For UK, it's a bit more complicated. So this is the PLAB 1, and it can be done throughout the year, by the way, the USMLE. There's no timing for the exam. Compared to the UK, the PLAB 1 is only done at certain times, in February, May, August, November. And it's either you do in the UK or in these countries. So Australia, Bangladesh, Canada, Egypt, Ghana, India, Nigeria, Pakistan, South Africa, Spain, Sri Lanka, Sudan, and UAE. So unfortunately, there is no Malaysia. So you cannot do the PLAB 1 in Malaysia. So you have to travel somewhere else. For me, obviously, I went to Sudan because I was doing my internship there, so I had a chance to do it there. But I mean, if you're going to think about this, if you're seriously considering this, you have to start thinking about where you're going to go. You could probably go to a few countries here without visa quite easily. You could go to Dubai, I think, if you wanted, UAE. Australia, I'm not sure if you have to get a visa for that. I mean, it's closer, but man, you have to think about that. And then PLAB 2 is only in PLAB 2 is only in UK, in Manchester. It's only in Manchester at the moment. So that one you have to fly there. But we'll talk about about that later as well. Now, after discussing all of this, you might be asking, why should we do US system instead of UK? The reason is, if you can get into US system, and honestly, if I had prepared earlier, I think I would have done the US system maybe. I would have done my step 1 around my first pro exam. By that time, my BMS should be better than it is now. Training in US is much, much shorter. So you can see the lengths on the side. Anesthesia, 5 years. Cardiac surgery, 3 years. Most of the thing are 5 years. Nothing is more than 5 years. and you don't need to do housemanship there. So for them, for their medical student, they go straight into training. They don't have like housemanship, you rotate to everything. You just do what you want to do. So technically speaking, if you had prepared well enough, you could go straight in. You could be done before your colleagues even start their training in like Malaysia or so on. And this the most important thing on the right, the salary. The salary there is crazy good. So if you are a consultant in any of these specialties, orthopedic 500k, dermatology 400k, general surgery 300k per year, 300k thousand US dollar per year, not ringgit. Convert to ringgit, you are making literally millions of ringgit lah. But when you are training, it's a bit less. So when you are still a resident is like what they call their trainees. You are making like around 60 to 70k per year. I mean, not as much as that, but it's really good money lah. Compare this to UK. UK again better than Malaysia, but nowhere near. So GPs, like I said earlier, GP only take 3 years and they get 100k. Consultant surgery, consultant medicine, consultant are the same in here in UK. Orthopedic, neurosurgery, pediatric, opta, they all get paid around the same, which is around 115k per year, pounds. And I put here the salary per as well, per housemanship year, from housemanship so on. From housemanship, 20k, up to 30k with your overtime and so on, and on call and so on. 45k in year 2, as houseman year 2, or as a junior trainee. Registrar 60k, consultant 93k to 100k. It's really not that much like compared to America. And the tax in UK is very high compared to UK to US. US tax around 15-20%. In UK, the tax is 20% to 40%, depending on your salary. So this brings me to to this picture on the bottom right. Because of this, most of the UK doctors actually they don't go into training straight away. They prefer to do locum job, service job, where they will make. So as a F3 they call it, or like as a third year, after you do F2, you just do another year. They can get like paid up to a consultant level. They can get paid 100k in 1 year. Compared to if they do training, they have to get the lower rate. So you can see less people are entering, less UK graduates are entering training. They prefer to just go because they have to pay student loans. They don't have scholarship. They have to pay back the student loans. They have to pay their mortgage. They live alone. So they really need money compared to what we see in Malaysia. Most people trying to be specialists. In UK, most people are very happy to just stay as MO and get paid much more money. Okay, we'll almost coming towards the end of presentation now. Financial requirements. So, okay, I think this is the most important slide actually for today. All this sounds very good. Okay, UK, US, all very nice, but honestly, can you afford it? So step 1, look at on the left is the US version. So step 1, the first exam alone is $900 plus 150, $1,000. Just say $1,000. Step 2, $1,000. CS is gone, so you don't need that. This is the materials if you want to like buy the past year exam and so on. You have to travel for interview in America. It's not online interview. You have to pay. Oh, and it's at the bottom here, program application. So once you get all this done, in order to apply for training position, you have to pay for your application. I don't know, like these capitalist people just taking all our money lah. So if you apply for 10 programs, you pay $100. More than that, you have to pay $12 per program you apply to. Most people end up applying to easily 50 to 100 programs. You have to apply to individual hospital programs. So again, you're looking at thousands just to apply for training. Compare this to the UK. UK on your right. So the first part of the trip is just the IELTS, which is around 160 pounds, or OET. You can do either or, IELTS or OET. OET is easier, but double the cost, 300 pounds. PLAB is about 235. It's increased to 250 now. After COVID, they increased the price a bit. So it's 250 pounds. PLAB 2 is 875 pounds now. And then if you need to go to UK to do the exam or somewhere else, you need a visa. Anyway, to summarize all of this, the total in Malaysian ringgit lah. More or less for UK, you're looking at 22,000 ringgit. It can be less actually. I think you can get it less. This is me giving a good estimate. For America, double this price and easily much more. So this is the reality lah. I think this is the reality of what you need to do. But all this being said, you've seen the salary. So I think if you are successful, I can guarantee you that if you can pass through all this, you will get all this money back in the first 3 to 6 months. You will make all this money back, lah. But I don't know if you have the capital to do this, lah. Not everybody can afford this, lah. Okay, this is my timeline. Like I said, timing is actually quite important as well. So for me, I took IELTS in July. By the way, IELTS is only valid for 2 years. This is important to note because you will see what happened to me as well. My pro exam next, PLAB 1 in Sudan, October. SMC for me is, Sudan Medical Council. So I went to Sudan, I got registered. I start my housemanship in April. I had the interview in Dubai in October, and then COVID happened, and my first PLAB got cancelled in March. I finished my housemanship in Sudan December because of COVID. I got stuck. I couldn't complete my housemanship. By this time, my IELTS expired because it's only 2 years, so I had to do my IELTS for a second time, which I did right before. But again, more money. Not to mention, I had like a lot of visas. A lot of my UK visa expired. I had to reapply. Flight tickets got cancelled. A lot of other things happened. I did my PLAB finally in April, and I started working in August. And hopefully, inshallah, I'll be starting my training soon lah, in August next year. And just to mention, so to apply for training in August, so training starts August every year. You have to apply by December of the year before. So I started applying from December. So when I started work in August, I needed to work at least 3 months to get signed off by the consultant. So the timing was very close. So August, I worked 3 months. By November, I got the sign. December, I applied and then got the interview and so on and so forth. But timing is also quite important. So you need to prepare early. Okay. Again, promise almost to the end. Please bear with me. A bit of pros and cons about working in the NHS. I tried to make it as fair as possible. So some of the pros, obviously the resources and facilities. I work now in a district hospital, so it's like a tertiary center, not tertiary, like a secondary center, tertiary center, a secondary center, sorry. We have MRI, we have CT, we have surgeon, we have ENT, we have optal, we have everybody in this hospital. Every hospital will have very good facilities. So that's a fact. So you don't need to refer. I know in some places in Malaysia, you will refer people to do just for appendicitis because there's no surgeon, for example, on in the hospital. So I mean, it's quite satisfying lah when you work where you have more facilities. International training. So if you train in UK, you have better chance to move anywhere else. You want to go to Saudi, Qatar, any country will take you lah. Almost any country will take you if you wanted to compare to in Malaysia. Support at work. If you're working in the NHS, I can say honestly, there is a lot of support. So, for example, in Malaysia, we have tagging. This for housemanship. So, for housemen, they will be tagging means they will be working from 7 a.m. to 7 p.m., running around all day. For UK, you will have something called shadowing. So, shadowing means you just come to work at the same time as normal people, and under supervision, people will see how you are and then they will help you. And if you feel you're not enough, you don't have enough shadowing, you can ask for longer. You can ask, oh, can I do 1 more week, 2 weeks? So they will make sure somebody is there with you all the time. So they're very supportive in that sense. Multicultural society, again, I came here, a lot of people. They had Pakistani doctors, Nigerians, Filipinos, a lot of people. I mean, that's interesting to see. Work-life balance, like we mentioned earlier, you have excellent work-life balance. If you have people here have kids, they send their kids to school in the morning. End of the day, they pick up their kids, no problems. No hierarchy. So what this means is, in Malaysia, if you've done rounds, you can see consultant on top, consultant scold the MO scold the HO, throw files at people. In UK, it's impossible. No such thing as hierarchy. The consultant cannot scold you. The senior nurse cannot scold the other nurse, and so on. Like they have everybody is the same, which is pro or con. I don't know. Like it depends on how you are. MDT, comprehensive MDT means, again, when you see patients, there's a big team there. There's every hospital has the OT, PT, dietitian, pharmacist. Everybody is there all the time, so it's very helpful, and I enjoy working in that way. It's very comprehensive. Systematic. I think working in NHS is very systematic. They are very systematic people. They are very thorough. Everything has checklists. Everything has system. Nothing can go outside the system. I guess that's a pro. A bit of the cons, very defensive medicine. Because they are very strict, they are very, very defensive. So the medicine here now is becoming very defensive. I don't know if the whole world will be like this or it's just here, but I mean, I can give you an example, like yesterday, or not yesterday, I was working a few days ago. a middle-aged man, 50-year-old, came with some chest pain. It sounded like, to me, it sounded like good, just like, oh, he says it like coming out, burning. So the consultant there won't listen to history. Some of the consultants, some of them, not all, won't listen to history. They just look at the chief complaint, chest pain. They straight away, okay, that means you have to do drop. If the first drop negative, repeat another drop in 6 hours. After that, they do D-dimer. This patient D-dimer came back a little bit high, but it was actually normal for the age. He said, oh, D-dimer is high, okay, do CTPA. At CTPA, he referred to the cardiologist. He did all this for a man who had what sounded to me like good. And in the end, nothing came. But this is how, I mean, it's very, very defensive, and I don't enjoy that. Same thing. If you have headache, they will, even just like a migraine headache, they will do CT, they will do lumbar puncture, they will do MRI. They are very, very defensive in that sense before let you go home. De-skilled. What this means is everybody, because there's a lot of teams, everybody only does their job. So, for example, in Malaysia, if you are an MO in medicine, you have to know how to do intubation, central line, so on. In UK, you're not allowed. You will learn it, but you are not allowed to do it. Not allowed, but not expected to do it. So, if there's a crash call, they will call NS. Anesthesia have to do the airway. Never will the MO of medicine do the airway or central line in the hospital. So, I think it a bit remove some of the skill out of the doctors. And another example is we have specialist nurses. So now the doctors here, they don't know asthma, they don't know COPD, they have respiratory nurses. They have nurses for everything. They have respiratory nurses who see asthma, COPD patients. They have cardiac nurses which see like heart failure patients. They have stoma nurse. They have, what other nurse they have? They have phlebotomists. So another thing is, like, I know in Malaysia, the houseman have to take all the blood, the cannula. Here at night, there will be a team that come, phlebotomists, they will come take blood from all the patients. So you're not doing anything, to be honest. The staffing pressures, like I said earlier, because of all these like work hour restrictions, there are sometimes you can be, like, especially on nights, you can be alone covering 4 5 wards, which is a bit stressful, to be honest. Length of training is quite long, to be honest. It's 8 years compared to Malaysia. I think Malaysia, like, master is 4 to 5 years, but you have to do the service MO first and so on. But the training is quite long, because they're trying to keep people in training longer because they have less doctors. Another con is competitive. I think something quite competitive, but like I mentioned earlier, they have very clear criteria for what they expect from you. So I think that's fair. Patient population. What I mean is that they have very aging population. I don't know if I'm being rude here or so on, but every day I'm seeing 80-year-old, 80 plus, 90-year-old patient, 100-year-old patient very routinely, and they just come to hospital because they have a fall at home. They don't have, like, their children don't look after them, so when they fall, the ambulance have to come bring them to hospital, and then they stay in hospital for 2 or 3 days eating food until somebody can find them a care home or something. So most patients, just geriatric patient, is a lot of geriatric patients, mental health patient. A lot of people have like mental health issues here, or anxiety, depression, suicide. Very, very common, and I don't know why they come to medicine, but I have to see them, and for me it's a bit frustrating. Family support. You obviously, if you come here, you'll probably be alone. That's something to think about. And the weather and food the weather is it's always raining, and the food, no, the food sucks. Okay, this is the last part of my journey. So now, alhamdulillah, I did my plab, I started the job. I actually, to apply to get a job, I had to, if you can see here, I had to apply to 126 jobs actually, because I did my CV quite wrong at first. But alhamdulillah, after I finished my CV, I got many job offers lah. And this is on the right here, this is the interview and so on for the internal medicine training that I've got, which will start in August, inshallah. And yeah, I'm just showing you how it looks like. Basically, I will rotate through a few hospitals in different specialties, and inshallah, move on to higher training. Okay, because we are UIA students, we have to have some IMP. I promise this is the second last slide. We're almost done. So this is a picture I took when I was at the bottom here is me as I was leaving, I think on the last day after pro-exam, with all my fellow brothers from Kaizen. And through all this, I was thinking about, I'm going to leave. I didn't tell anybody that I'm leaving, but I was thinking about all this at the time. And I read this ayah recently as well, which is from Surah An-Nahl, ayah 41. Bismillahirrahmanirrahim. وَالَّذِينَ هَاجَرُوا فِي اللَّهِ من بعد ما ظلموا لنبلونهم في الدنيا حسنة ولأجر الآخرة أكبر لو كانوا يعلمون الذين صبروا وعلى ربهم يتوكلون. صدق الله العظيم. So this ayah is relevant to you if you're going to immigrate. So the thing is, if you feel like you are zulm, you are being oppressed, you feel like it's not fair and so on. Just remember that Allah said that if you immigrate in the sake of oppression or because because of your circumstances, Allah will help you in this world, and inshallah in the akhirah you will have even greater. And I find this ayah very comforting to me lah. It helps me to think that okay, I know my friends are having, they get to stay home, in Malaysia with their family, and I haven't seen my parents. For example, for me, I haven't seen my parents in like 2 or 3 years now because of COVID, and so I haven't seen my parents are still in Malaysia. But this ayah helps to keep me comforted sometimes. And this hadith as well, which is about the niyyah. So أنا عمر ibn حذيفة رضي الله عنه قال رسول الله صلى الله عليه وسلم إنما الأعمال بالنية وإنما لامرئ ما نوى فمن كانت هجرته إلى الله وإلى رسوله فهجرته إلى الله وإلى رسوله ومن كانت هجرته إلى الدنيا يصيبها أو امرأة ينكحها فهجرته إلى ما هاجر إليه. I think if I had to have one take home message in terms of like, should I go, should I not go, I think this is the one, which is that the actions are by the intentions. So what do you intend to do? What is the reason for you leaving? Is it is it for your sake? Is it for money? Is it for a family? You have to just think about what you want to do basically, and just betulkan niat. Fix your niat. Make sure your niat is for Allah and for the Muslim ummah, inshallah. And I also want to say that I think it's important to have your priorities lah. Because some of my friends also ask me, should they go, should they not go? I tell them, look, your life is about priorities. What is your priority in life? Is it important for you to stay with your family? Because I mean, to be honest, I'll be honest. If I had this chance, I think I would probably stay in Malaysia. I will. I mean, every day I see my parents; they're getting older, and I'm not there with them, and they're so, and you feel like you are the oldest child. You need to be with your parents, but that's not option for me at the moment, lah. But if your priority is that you think your priority is work or specialty training or whatever priority is, I think that will determine what you should decide to do. These are the references. I will leave them. I think you can look at them. These are some of the good slides, good websites to show you further about how to get registered and so on. And if you need some Google Drive, I have some lab materials, PM to P, because I cannot share this online. I think I'll get in trouble. And good luck for pro exam and beyond, everybody. That's all from me. Any questions?
All right. Thank you very much, Brother Musa, Dr. Musaab. Right. So, do anyone have any question? I think if you guys can always ask me for Musaab's number. Will that be fine, Musaab?
Yeah, that's fine. 100%, no problem. Yeah. Like I said, I'm willing to help anybody who wants to go on. Like I said, it was hard for me to find all this, so I appreciate that if I can share this with you, I will share it with you.
All right. Okay. So if you guys want his number, I will just send you his number, and he will share the links and any other advisors that you guys need from him. I'm pretty sure Musaab is willing to help. He has been a great mentor since in Com, and now he is willing to come back and share all of his struggles and everything, which is actually quite inspirational for whatever you have gone through. And hopefully that will be a source of an easement for all of us who are here. And thank you very much for taking this opportunity. But before that, any questions? Anyone have any questions? You can always write it in the chat box, or you can just open up your mic. It's fine.
So can I just ask anybody who was previously thinking about going, after you've heard all this, anybody thinks that they don't want to go anymore, or people who didn't want to go previously, now that they want to go, has anybody changed their minds, do you think?
I think that must be like some sort of a mix. Is it?
Yeah, it's really mixed, definitely. I agree.
Yeah. Alright, guys. This is the opportunity, guys. Like Musaab is a busy guy, man. Pastor, ask him questions. Take this opportunity. It took us for two months to set this date. But actually, the yeah, the problem was from our side as well. We are really sorry for that.
That's fine. That's fine. Where's Hakimi? Hakimi didn't ask
Yeah.
any. Is he still here?
What's up?
Okay.
I'd like to ask some questions.
Yeah, sure. Bro.
For the plan, how long is the average waiting time to apply for the seat for part one, part two? Because I have read somewhere that they say they have to wait very long time for, especially for the part two.
Okay.
Maybe because of COVID, I'm not sure.
Yeah. Okay. So that's a very good point. So actually, when I applied, literally at that time, the seats were like flooded, like everywhere. Like I think I booked my pleb one like the day before, like maybe like it was there was a lot of spaces open. And pleb two, same thing. When I was booking the pleb two, like I booked it the first time for March 2020. I think I booked in February. So it was at that time, it was very open, very easy. There were no problems. But I think the problem happened due to COVID lah, because they stopped all the exams. Actually, I had to repostpone 3, 4 times as well. The point is because they're closed for a while, they had a huge backlog. I think they are working through the backlog now. I'm not sure what the exact date was, but at the worst, when it was like peak COVID, they had to prioritize certain people over others, like depending if you're in UK, if you had job offer. But I think at that time the worst was like 4 to 6 months lah to get a spot. I think at that time, but I think it's going to get better soon, and they're trying to open more centers. So it used to be just Manchester, but they're going to try to make other centers like in London, Birmingham, and so on lah. So I am hopeful. I think by next year maybe it should come back to normal lah. As far as Plab 2 is concerned. Plab 1, I think it depends on where you book. So certain countries, they get booked very fast, India, Bangladesh, so on, because everybody there is always trying to go. Certain countries are always empty. Like Sudan, I think it was quite easy. But there was a few, because not many people go to Sudan to do the exam. There were some Syrians, some Egyptians, I think, as well, because Egyptians couldn't get a spot in Egypt, so they came to Sudan. So it depends on the country you want to go to, so you should probably look earlier lah. And the thing is, because it's only there 4 times a year, not like the USMLE open all throughout the year. So I'm not sure, but you have to look. You have to look for the Pleb 1. For Pleb 2, it should get better soon.
Okay. And then my next question is like, it's a more to a personal type of matter because I would like to inquire about the financial like commitment like of a daily doctor in the UK. So like,
okay.
How is their monthly income and what is the division of their expenses that they have to pay and what is left for them at the end of the month? Like, is it like a substantial amount of money or like just okay?
Okay, so let me come back to the salary. Okay, so if you come at around this level, 45K per year, this is where, so currently I'm making like 40K per year is my basic salary. So if I don't do locum and so on, if you do locum, you can like double it up, maybe up to like 80K per year. So that's like before tax. So after tax, you are looking at like maybe 50 to 60K per year, which is around 4,000 per month. Now, the cost of living in UK is generally quite okay. I mean, it's definitely better than Malaysia. If you want to know, compared to Malaysia, as a HO and MO, you're better. As consultant, it will be worse, but as HO MO, you're better. So I can tell you, for example, I don't have problem sharing all this. My rent, for example, I'm paying now is like 450 per month. So let's try and calculate. So from the 4,000, let's say I'm currently making, I do quite a lot of locums lah. So let's say I didn't do locum. Let's say I did just the 3,000, my basic per month. Minus 450 for the living cost. Actually, I'm living in quite a cheap area, so it's 450. If you live in London, you are looking at like 1,000 plus for a small studio. So let's put average. Let's say like 800 lah. So 800. The most expensive thing will just be the rent, the food and drink and so on. Like I don't spend more than 30 to 30 lah per groceries per week, milk, meat, so on, all those things. I think at the end of the month, you can easily save like more than 2,000 pounds easily. Is 2,000 pounds, which is like 10,000 ringgit. So I don't know if you're sending money back home to Malaysia, you are like a king lah. You can send easily, no problems lah. You will have a lot of money, I think. So the doctor in UK is already like more than the average salary of the UK resident, or just the basic salary is already more than the average UK resident. So it's very matched to the living cost. You will have enough. You will definitely have more than enough. You can save a lot of money. Yeah, I mean, I think some of those blogs I shared earlier, they give you the cost by cost breakdown, but I can easily tell you that you can easily save more than 2,000 per month if you're living alone, no other commitments, like you're not paying for school or kids or so on. Yeah, you can easily save more than 2,000 per month, no problem.
Okay. Okay, thanks, Musaab.
No problem. That's why, like I said earlier, in the first 3 months, you can get back all the money you spend on the exams. Like you like, let's say that the first month you spend 2,000. If you like that 1,000 you spend to pay back whatever if you borrow somebody's money, 2 months you can get back 20k ringgit easily lah. You can pay that back. The thing is just when you become a consultant, the salary, because the tax will increase, the salary is not that high. So the difference between a like MO and consultant here is not that high.
Alright, okay, Musab, just to get things clear, right? So
Yeah.
if you want to get a job in UK as like as a doctor, like MOHO, then we will have to do PLAB 1 and PLAB 2. But if we want to go for registrar, then we will have to do MRCP. Is that right?
100% yes. So
Right.
so you like there's two options or two routes. So if you do the PLAB, you can do the full PLAB first, then you can do the junior MO ship first lah, which is what I'm going to do it now. So you do 3 years as MO. During that time, you pass the MRCP and then you can become registrar. Or if you are like working in Malaysia for a few years, if you pass your MRCP throughout that time, then you can come straight away apply as a registrar lah, and you can come. You'll bypass the first 3 years of training. You enter as registrar. But again, you have to pass the interview and all those things we mentioned about earlier lah.
All right. Okay. So my next question is, when it comes to PLAB 1 and PLAB 2, can we only work in UK? And if it is USMLE, can we only work in US, or it is compatible for other countries as well?
That's a very good question. So this shows the power of the world lah, basically. If you have US exam will let you work literally any country in the world. Any country, if you're a US doctor, you're USMLE, you probably can work anywhere. UK, you can from US you can come to in UK, but from UK you cannot go to in US. So UK does not recognize the US doctor. You can have PLAB, you can have MRCP, you can be consultant UK. They don't care about that. They want USMLE. So I think that shows the power shift in the world. Who is the real world leader? But if you have the PLAB, like I said earlier, so if you pass PLAB and you work NHS for like 1 or 2 years, you can go to Australia. You can go to most Middle East countries. If you become consultant in UK, I think you can work back. Malaysia will take you back for sure, and quite a few other countries lah, including Ireland. Most of the countries will take you, except for America and whoever follows the American system. So there's America, Canada. I think those are the two exclusive ones who will be like, no, they only take US system. US can go to US, Canada, and can come down anywhere else, but UK cannot go up to US and Canada.
Right, but then that will be like USMLE is quite, was it more expensive, right?
More expensive, definitely, and I think way more difficult. But I mean, the thing is, at the end, the money you're making is like 10 times more than the other people lah.
But that will only be because if we do USMLE and work in US, right? If we do USMLE and we go to UK, it's like a down, like it's just like
it's a bit of it's a bit of a waste lah. If you do USMLE, if you can pass it, you should definitely apply to US lah.
All right. Okay. All right. So, anyone else have any questions, any inquiries, anything that you guys would like to share? Maybe.
So I'll give you my number later. You can ask for or I will. What should I do? I think I will share to you the Google Drive link. Maybe that's easier with all the PLAB materials. You can just spread it out to whoever wants it. Like, as long as it's inside the WhatsApp groups, it's okay. As long as it doesn't go like on the internet. You're like, oh, I'm sharing material, and it's okay.
I think we will just put in our Google Drive, and then we will share the link of Google Drive with everyone. Like, you can just share it with our Google Drive.
Yeah.
Okay, so Samba, can we have a photography session? Everyone can just open up their cameras as well. Musa, stop the screen share.
Okay. Okay, stop sharing.
Samba, will you lead? Yeah, Hazrik is from hospital, I think.
Hi, Hazri.
Yeah, working.
Sehat ke tu?
Sehat.
Posting apa sekarang?
Surgical.
Okay.
Thank you very much. Okay, thank you, Samba.
Right,
Right.
good luck everybody. In Amol, Hakimi, take care.